We support standing together for nutrition because we need evidence to inform policymakers and society how the COVID pandemic affected health and nutrition of children and pregnant women.
United, challenging times when COVID is impacting on all systems. We need a united front to assess the true impact of COVID on nutrition. This is what Standing Together for Nutrition aims to achieve.
Why I chose the word malnutrition is because it's doing a lot of havoc.
Children are our future, and there's 283,000 additional child deaths due to malnutrition caused by this pandemic that we are projecting here. These are not just numbers or statistics, these are real children that are alive today, and if we don't act now, run a risk of not reaching their 5th birthday. We cannot let that happen.
COVID-19 has exacerbated inequities both within and between countries. I believe that the advocacy the consortium is doing is essential to increase knowledge and motivate action to build back after the pandemic.
Backsliding. We must take action now to avoid backsliding on the amazing progress we've made to meet the nutrition needs of mothers and children in face of the COVID pandemic and the climate crisis.
My word for standing together is together. Countries and communities around the world must work together, act together to address the crisis during COVID-19 pandemic. We must act with urgency to support the most vulnerable in low and middle income countries to prevent all forms of malnutrition and their consequences to save generations, especially in this pandemic, in this evolving COVID-19 pandemic. Act together, work together, all the people in the world. Yes, we can.
Well, hello everybody. I hope you can hear me and actually see me as well. We are here at this event organized by Standing Together for Nutrition. It's a webinar that's part of a World Health Organization Health Talks organized as part of the preparation for this year's United Nations Secretary General Food Systems Summit, and that's taking place in September at the United Nations headquarters during the United Nations General Assembly. Do you know we've never had a summit on food systems ever before? And it's coming just before another key summit moment, Nutrition for Growth, taking place in Japan. So altogether, 2021 is an important time for food systems and nutrition. But also, because I've got another role that might interest you, I'm Special Envoy of the Director General of WHO on COVID-19, I thought that it might be helpful as we set the scene just to remind everybody that those of us who are committed to ensuring long-term improvements in the nutrition of those who are most vulnerable are finding that the COVID pandemic is actually working against us. There are reasons why the COVID pandemic is contributing to more malnutrition and suffering. And today's webinar is to look at that, to look at the relationships between COVID-19 and nutrition, and to think really hard about what are the implications of what's been learned over the last 15 months as we look forward, because this pandemic has got a long way still to run, and we might as well be very clear on the actions that need to be taken to ensure the care for the nutrition of those who are most at risk. Now, we've got a packed program, and before we get started, I'd just like to let everybody know, first of all, that this is being recorded. And secondly, we will be sharing the recording on YouTube shortly afterwards. And that is also combining with the fact that we are involved in live streaming. So altogether, this is a public broadcast. Now, we're offering simultaneous translation. That means you can hear the presentations in English, French, and Spanish. And the instructions for the dealing with the interpretation can be found in the chat part of this Zoom discussion. Now, there'll be a question and answer session at the end of this webinar. I'll be taking your questions, and we've got a very nice system built up for doing that. So please submit the questions that you might have for the speakers using the question and answer tab. I can see there's already one notification in there. So use that, and please vote on your favorites. If you can look into the question and answer, if there's a question there that you really want answered, give it a tick. You know what to do, and it adds to the likelihood that we'll come to it. And so we'll try to answer as many as possible. I'd also like to thank the Standing Together for Nutrition, Micronutrient Forum, and GAIN, that's the Global Alliance for Improved Nutrition, for coming together to host this absolutely vital event and to bringing awareness to the importance of investments in nutrition. So now we get on with the webinar. So first of all, I hope that we'll see in a minute a slide showing a picture of the Executive Director of the Micronutrient Forum, Saskia Ossendarp. Saskia is a real leader. She's actually an electric person who makes things happen, a really special person in my view. More than 25 years of experience in international nutrition research in both the public and private sectors. And she's a visiting associate professor of nutrition and health at Wageningen University. During her career, she spent time in Bangladesh, working at the International Center for Diarrheal Disease Research, and she also had time as lead scientist in micronutrients and child nutrition at Unilever. Saskia has also worked as an independent consultant for international NGOs, academia and research institutes. And she's had an enormous influence on my own professional development, leading me to understand her perceptions of nutrition as a global issue and how we can get all stakeholders coming in behind it in the most incredible coordination. She's great. Thank you for your dedication and your work in nutrition, Saskia. The floor is yours for your 5-minute presentation.
Thank you, David. These are very, very nice words. And I'm really honored that you are here today and help us moderating this important event. And that has been pulled together, as you said, by the Standing Together for Nutrition Consortium. And that's a consortium that was established last year when the pandemic first happened back in March, April. And there were many concerns within the nutrition community and beyond about the potential impact that this COVID crisis could have on malnutrition. And the consortium, the Standing Together for Nutrition Consortium, was formed really in response to this, to guide decision makers with evidence in a holistic approach, forming a consortium of global and national experts from multiple disciplines to really reflect these 3-in-1 crisis that we see here. It's a food systems crisis, a health systems crisis, and an economic crisis leading to this nutrition crisis. So Standing Together for Nutrition's first estimates on the impact of COVID-19 pandemic were done last year based on assumptions of COVID-19 related disruptions in food systems, affecting supplies and food prices, in the disruption in the coverage of essential nutrition and health services, and of economic projections. And the effects of the COVID-19 crisis on different forms of child and maternal undernutrition were estimated and modeled by this consortium for 3 years, for 2020, 2021, and 2022, and according to 3 different scenarios based on assumptions in 2020, last year, on how the pandemic and the associated mitigation efforts and economic efforts would unfold. So we had a pessimistic scenario, a moderate scenario that we presented, and an optimistic scenario. And now we are in 2021, and unfortunately, the pandemic is not yet over. And we still don't have real-time data on what actually happens to malnutrition, simply because countries were not able to implement household surveys due to the pandemic, and these surveys are required to collect that type of data. However, we do have data that demonstrate that our underlying assumptions on how the COVID-19 pandemic would affect the underlying drivers of malnutrition, how these assumptions were correct and perhaps even too conservative. Because we know that COVID has pushed an additional 150 million people into extreme poverty, and the numbers of food insecurity and hunger are on the rise globally as a result of COVID, in combination with persistent conflicts and climate change. And of course, like in any crisis, also the COVID crisis impacts women and children the most. They are the most vulnerable. And we see that also in the disruptions that are being reported in the supply of nutritious foods, such as vegetables and fruits and animal source foods, leading to an increased prices of these foods and a decreased consumption of these foods. And this has been reported at local levels. So UNICEF last year reported an overall reduction of 30% in the coverage of essential nutrition and health services. So these included school feeding, this included antenatal care services that they delivered, for instance, multiple micronutrient supplements to women. It included the large-scale vitamin A supplementation, the treatment of severe acute malnutrition. And in some regions, such as South Asia, the reduction and the disruptions in the delivery of these services were more than 50% in the second quarter of 2020, and were not yet returned back to normal earlier this year. And this was before the second wave of the pandemic hit this region very hard. So the situation is really grim now, and we are concerned that given the acceleration of the pandemic in many low and middle income countries, and particularly in these populous countries in South Asia that had very, very high numbers of child malnutrition before COVID, that the real impact therefore may be more devastating than what we thought last year, and may actually be closer to our most pessimistic scenario. So we may see that the pandemic could result in an additional 13.6 million wasted children. This is acute malnutrition, an additional 3.6 million stunted children, and an additional 283,000 child deaths by 2022. And in addition, we anticipate an additional 4.8 million maternal anemia and 3 million women with low body mass index, and an additional 141 million people who cannot afford a healthy diet, according to the pessimistic scenario of our estimates. And this will further aggravate undernutrition. It will also impact micronutrient malnutrition and even obesity and diet-related chronic diseases. And because early child malnutrition is known to affect brain and cognitive development, school performance, and also the earning capacity as an adult, all these additional child malnutrition cases are of course a disaster for these children and their families, but they may also lead to an additional $44 billion in economic productivity losses down the line. And there also are immediate impacts that we can expect on the pandemic mitigation efforts, particularly in countries with very high undernutrition rates. because we know that undernutrition, particularly during pregnancy and childhood, but also in later life, is known to impair immune response and possibly also the response to vaccines, and to vaccinations. So we really have to act now, and we really have to ensure that investments in nutrition are included in the COVID-19 response efforts. Thank you, David, and over to you.
Oh, thank you. Saskia's last point, everybody, is the key point. And I felt that the way she built the argument was just great. Investment in ensuring good nutrition has to be a part of the COVID response. There's just no alternative, because the alternative is unthinkable. There's enormous number of children actually suffering as a result of the nutritional impact of COVID and the response to COVID. Thank you, Saskia, for stressing just the enormity of the problem and the need for action now. And so that brings us to our next presenter. I'd like to invite Sean Baker to give us a global perspective on what's going on. Sean brings 30 years of international public health nutrition experience. He was the first director of nutrition at the Bill and Melinda Gates Foundation. He's currently the chief nutritionist for the United States Agency for International Development, or USAID. He chairs the agency's Nutrition Leadership Council. He also oversees the vision and strategy of USAID's Center for Nutrition. And he's very active in this center within the Bureau for Resilience and Food Security. And he's coordinating nutrition-related events right across USAID, as well as guiding investments and engagements with partners to address malnutrition in developing countries. So that's Sean's achievement. I know this person as the most incredibly generous, open-hearted, and highly effective connector for nutrition. He turns people on to the issue. And so it's with enormous pleasure that I offer you the floor, Sean, to talk about the global picture. Thank you.
Thanks so much, David, for that generous introduction. And I echo your thanks to the Standing Together Nutrition Consortium and GAIN and the Micronutrient Forum and WHO for pulling this event off. I always like to start at the beginning of why is nutrition important. 45% of under 5 deaths attributable to malnutrition. And for those children who survive malnutrition, we know we fundamentally impaired their futures. And we need to lead with that because for just what you said, David, for those people who say, okay, well, we can wait until we deal with COVID before we can deal with nutrition, or that nutrition is competing with other priorities, that is not acceptable. The last 13 years have, to my mind, really seen a revolution in nutrition, and that's based on 4 decades of experience in nutrition, starting with the 2008 Lancet series on nutrition, which catalyzed action, including the creation of the Scaling Up Nutrition movement, where we're now at 63 countries, 4 states of India, getting very strong targets on nutrition endorsed by the World Health Assembly in 2012. The first time we got serious as a community about financing for nutrition with the first Nutrition for Growth Summit in London in 2013, getting nutrition enshrined in the Sustainable Development Goals, particularly SDG 2. And we have been on, I think, a positive trajectory. Not enough progress, but progress. And so I am, if you look at the Global Nutrition Report, if you look at the 3rd Lancet series, which came out at the beginning of this year, you can see, yes, there's progress, but not enough. Now, I'm a glass half full guy because when I see that there's not enough progress, I also see the evidence that there's enough progress to know we can do it. And this brings me to what I say are the 6 no's. We know the problem, we know what works, we know how to take to scale what works, we know what it costs to take to scale what works, and we know how to measure it. And now, because of these projections, we have even more information of what the cost of inaction will be. And as David, you had said, the cost of inaction in face of this pandemic to me is unacceptable, and we cannot let it happen. These projections are invaluable and they are grim. And we could be in a situation where we lose a decade of very hard-won progress. But again, I'm an optimist, and projections are not destiny. we can take urgent actions now across the food systems, the health systems, and the social protection systems that can mitigate the impacts of the pandemic on the nutrition of women and children and put us back on a trajectory where we will be reaching those WHA targets and sustainable development goals. One of my most moving experiences in global summits was in 2017 at the Global Nutrition Summit, where Mrs. Graça Machel took the floor. And she reminded everybody in the room and on the global stage of the promises we have made to women and children to deliver on nutrition. And she said, as a mother and a grandmother, and I quote, "You can never break a promise to a child." And as David, you've laid out at the beginning here, in this year, we have great opportunities to keep our promises to women and children throughout the world. With the United Nations Food System Summit, the Nutrition for Growth Summit, already Canada, Bangladesh, Guatemala, Nigeria, Pakistan, and Senegal have kicked off the Nutrition for Growth Year of Action in December 2020. We really are in a position to elevate nutrition as a fundamental issue, not a competing issue, to achieve everything we're trying to achieve. And we see what the cost of inaction can be. So we really need to go forward. And I think it's incumbent on everybody on this call and a much broader agenda to make sure that the projections that Saskia shared with us are not our future, but we can fight against that future and make a better future for women and children across the world. Thanks, David, and back over to you.
Oh, Sean, what a start. Can I tell you, everybody remember this vintage Sean Baker quote: projections are not destiny. And that's what's so important. You see, we've got these projections and actually we can be pretty certain that they're close to the truth. But the point is that we can act and we can prevent them from being destiny. Stenica, you've got your hand up. Do you want to come in? Okay, I'm assuming the hand up is just one of those things. Look, everybody, share your thoughts on what Sean just said, because we want to get material coming into the Q's and A's, coming into the chat, and then we can build on it. And now I'm going to move to our next speaker, Megan Kane, Director for the Global Health and Nutrition Platforms Division of the Health and Nutrition Bureau at Global Affairs Canada. Megan is responsible for Canada's international commitments and investments in nutrition, infectious and emerging diseases, health systems strengthening, and global health platforms, including Gavi and the Vaccine Alliance. We're super lucky that this really busy person is able to join us. And so, Megan, thank you for being here. Over to you for your inputs. Thank you.
Thanks, David. Bonjour à tous et à tous. C'est un très, très grand plaisir d'être ici avec vous aujourd'hui afin de partager la perspective du Canada sur l'importance d'investir dans la nutrition comme un élément critique dans la récupération de la pandémie COVID-19. During these difficult times, when more is required of all of us, Canada is proud to be working with so many of you to tackle the growing nutrition challenges the world is facing. We know that malnutrition rates were increasing prior to the pandemic. We know that the pandemic is exacerbating inequalities and threatening to reverse decades of hard-won development gains, as my previous speakers have mentioned. And we know that women and girls are facing the impacts of this most acutely. Past crises have taught us, often at too great a cost, that nutrition simply cannot wait. Nutrition programs aimed at women, children, and vulnerable populations cannot be deprioritized. The economic case is clear. Not only does nutrition have one of the highest returns on investment, it increases returns in all other sectors as well. Funding for nutrition means bigger impacts for every dollar invested in health, in education, in gender, in economic growth. And we know that good nutrition helps boost the immune system, lowers the risk of becoming critically ill with infectious diseases, and supports faster recovery when infected. If our response to COVID-19 is to be truly effective, good nutrition must be a cornerstone of our efforts. The biggest vaccination campaign in history is underway. The COVID-19 vaccine campaign creates a unique opportunity for bundling together critical health interventions, in particular in low and middle income countries. And I would challenge us all to think about how we can take advantage of this moment. How can we leverage the investments that we're making in immunization campaigns to bring nutrition information to communities? How do we ensure that those healthcare workers are empowered to recognize nutritional deficiencies and get people the information and the care that they need? We need to target our efforts to those who need it most, the women and girls who, despite planting the crops, working the fields, and selling the food at markets, still earn and eat less than men and boys. We need to reduce the data gap facing the food security and nutrition sector by generating evidence-based data to support sound policy decisions, to better understand who is suffering from hunger and malnutrition, where they are, and tailor solutions to local contexts. Working with the Standing Together for Nutrition Consortium and exploring how the pandemic has affected populations has been a key part of Canada's effort to bridge this gap. Most importantly, we must work across sectors and across stakeholders to find innovative and cost-effective public, private, and voluntary sector solutions to the nutrition challenges we're facing today. Official development assistance alone is not enough. We need all hands on deck to protect the nutrition gains that we have made. For our part, Canada is committed to improving nutrition for the world's poorest and most marginalized, especially women and girls. As Sean mentioned, in December, our government, along with Bangladesh, co-hosted the launch of the Nutrition for Growth Year of Action, which mobilized over $3 billion for global nutrition. Canada committed 520 million Canadian dollars to nutrition-specific interventions over the next 5 years. We will deliver on our nutrition commitments, including essential nutrition services like micronutrient supplementation, antenatal care, breastfeeding education, while working to end this pandemic. And we encourage others to join us. We hope to see a cascade of pledges for nutrition from now until the N4G Summit in December. Il y a encore beaucoup de travail à faire, mais en travaillant ensemble, nous nous assurons que la nutrition demeure une priorité dans nos efforts de récupération de cette pandémie et que les voix de les femmes et les filles soient autour de la table pour le bien-être de tous. Merci. Thank you, David.
Merci, Megan Kane. Hey everybody, that was absolutely great. And one thing I really enjoyed was Megan saying, you know, we are in the midst of the biggest immunization campaign that I think any of us will have ever lived through. This is a giant campaign, a global campaign with vaccines that will probably have to be adjusted at intervals, so it'll be ongoing. And what an opportunity, as Megan suggested, to build our thinking about nutrition into all the interactions that are going to take place around the immunization campaign. Thank you again, Megan. Thanks for the support from Canada on the investments in nutrition. So valuable. Now we're going to move into a conversation between voices who've been working on nutrition in different locations. These are people actually that I've known well, and I'm so glad that they're here. So I'm going to introduce them all. And they're going to be discussing what they are doing in their country settings to integrate nutrition into a holistic approach to responding to COVID-19. And so I'm now going to bring on stream for talking to you the following. First of all, Secretary Mr. Lokman Hossein Mia, who is in the Health Services Division of the Ministry of Health and Family Welfare in Bangladesh. Then Shweta Kandawal, Public Health Foundation of India. And then Abdullah Kar, National Executive Secretary at the National Council for the Development of Nutrition in Senegal. And Bernice Cunningham, who is a youth voice from Nicaragua. Bernice will speak in Espanol, Abdullah will speak en français, and we will run the panel in a multilingual way. Now, everybody, remember, your Zoom should enable you to access interpretation if you want to. There is a button down at the bottom on a computer which looks like a representation of the globe, and it says Interpretation underneath. And if you click on that, which I'm just doing now, it gives you the choice of languages, English, French, and Spanish. Do give it a try, and I will make certain that I will tell you when we're shifting languages, and so you can find your way in. So the first thing is I'm just going to actually ask all our panelists to answer, if they can, in one word, but of course it might be one or two words, a little bit about how they are seeing nutrition being built into the country response planning in the countries that they're focusing on. What's actually happening? How is nutrition coming into COVID-19 responses? And so, keeping the words really short, to each panelist, I'll go one by one. How would you describe things nutritionally during the COVID-19 pandemic? What are the challenges faced? And if you can, just quick, and then I'll come to you for longer comments in a minute. But first of all, to Secretary Lokman Hossein Mia, quick take, sort of prelude to your answers now, please, sir.
Thank you very much, Mr. David. Excellency, distinguished delegates, excellencies, ladies and gentlemen, Assalamu alaikum. Very good morning and evening to all of you. It's a great privilege for me, and I am thankful to you to invite me in the event of COVID recovery. Why investment in nutrition cannot wait. A session during the WHO Food System Summit, Dialogue Health Talks, discussing the impact of the pandemic and the urgency to prioritize nutrition or COVID-19 recovery policies. Bangladesh has made immense achievement in economic, food security, health and nutrition, and its progress is steady since 2010. The country is on track for achieving its child nutrition status set under the NPN2 Second National Plan of Action Plan of Nutrition by 2025. Over the past decade, malnutrition rate have declined. Something is now below WHO critical threshold of 40% started. Of the children decreased from the 36.1% in 2014 to 30% in 2017. Wasting also decreased from 14%, 40.3% to 8% during the same period. However, like many other countries, COVID-19 threatened us to reserve this trend as risks undoing the hard-earned progress that been achieved. The advance of the COVID-19 pandemic and its spread has disturbed the life and livelihood of the population, but more damaging effect in France to the vulnerable group, especially the under 5 children and pregnant mothers. Like in my country, the current COVID-19 crisis has deeply impacted all unlink the proximate drivers of malnutrition in Bangladesh. There are several predictions that a number of children, around 40% of vulnerable children, may suffer from the malnutrition during the COVID-19 pandemic in Bangladesh. However, we all together manage the overall situation under the guidance of our Honorable Prime Minister Sheikh Hasina. She advised to cultivate every inch of our land and provided numerous additional social safety net package during the COVID-19 situation. We are providing hand cash as well as food package to the poor people and taken several local oriented initiatives to manage this crisis. We all together working, and at least we are in a better position now in the Southeast Asia region. An innovative approach introduced by government to call 333. If anybody needs food support and food assistance is being provided on behalf of government to the caller after getting call. Thank you.
Secretary Mr. Lokman Hossein Mia, could I thank you very much indeed for being very precise on what you've done. And I want to draw everybody's attention to something you said, highlighting it, that you've had incredible experience with being able to contribute to reductions in levels of both stunting and wasting in Bangladeshi children. And you took account of this as COVID started to hit in Bangladesh. So you prioritized both health and nutrition for young children, and you believe on the basis of that you've been able to build on your long-standing experience to reduce the risk that COVID was going to lead to a great increase in malnutrition among Bangladeshi children. This is wonderful news, and thank you for sharing with us the care that's been taken in Bangladesh to build on previous experience. And I hope that we really are able to, as a result, see that there have been numerous young children protected through the quality of the action that's been undertaken. I'd now like to go to Shweta Kandawal. Shweta is from the Public Health Foundation of India. What would be your opinion on the situation for children in India as a result of the way in which the pandemic is moving right now? And in the efforts to build the resilience of populations, is it possible to weave in nutrition as part of the response in your country? So over to you, Shweta. You have the floor now. I hope you don't mind me referring to you by your first name. Sorry. Thank you.
No, absolutely all right. Thank you for those important questions. I think the situation in India is unfortunately very grim. The good part, however, is that it's not sidelined completely, because the ministers here, the leadership here is cognizant of the fact that malnutrition exists in a massive way. And therefore, there are some schemes and programs which they are trying to get up and running. There are obviously services which have been hit because of COVID and because of distancing issues and other infection-related scares. But the overall situation is very, very grim. It needs urgent nourishment and nurturing, in one word, as you had asked. I'm sure, I think, in terms of response of what India can do and how nutrition can be addressed while working in terms of building the resilience of population. I have some inputs in terms of solutions, but I think I should come to that in the next round. So I'll hold my comments here. Thank you. Back to you.
Thank you very much indeed. It's a grim situation, and urgent nourishment and nurturing is needed. And I think what you've just made clear to us all, Shweta, is that this is not something that can wait. It's a bit the point that Sean was also making. Weave it in now. Don't delay. It could be too late. So grateful to you. To Dr. Abdoulaye Carr, National Executive Secretary of the National Council for the Development of Nutrition in Senegal. So Abdoulaye Carr, there have been major disruptions in food systems and nutrition due to the COVID-19 pandemic. With food prices on the rise, how can we ensure food systems reach vulnerable populations with micronutrient-rich foods? Abdoulaye Carr, merci beaucoup. Vous avez la parole maintenant. Bienvenue à notre panel.
Merci beaucoup. C'est une joie immense, David, de te retrouver et de retrouver tous les champions de la nutrition dans ce panel et ce webinaire. David, je vais te donner quelques mots. Tu vas choisir après comme apéritif. Je vais d'abord te donner le verbe se réinventer. Ensuite, je vais te donner quelques qualificatifs: agilité, opportunisme et créativité. Parce que avec le vécu que nous avons au niveau du Sénégal par rapport à la problématique COVID-19 et ses impacts sur le système alimentaire, sur le système sanitaire, nous avons dû traverser faire ces actions-là. D'abord, nous réinventer. Ensuite, avec des caractéristiques d'agilité, des caractéristiques de créativité, mais aussi d'opportunisme. Vous avez touché un point important sur le système alimentaire par rapport aux groupes les plus vulnérables. Quand on est sur une perspective nutrition, nous sommes situés sur la jonction entre les services spécifiques nutrition et les services sensibles nutrition pendant cette période de pandémie. Alors, comment est-ce qu'on va, sur les questions de ciblage, sur les questions de choix stratégiques par rapport aux initiatives communautaires qui vont renforcer les capacités de résilience des communautés. Quel choix faire? Dans le domaine de la sécurité alimentaire, s'il s'agit d'agriculture ou d'élevage, qu'est-ce qu'il faut faire? Quelle option prendre pour renforcer la résilience? Quand il s'agit de protection sociale, quel type de filets sociaux de sécurité il faut mettre en place? Nous sommes passés à travers tous ces filtres de réflexion pour mettre en œuvre certaines interventions. Et ce que nous avons remarqué, c'est que le fait de se concerter avec les secteurs en question, comme la santé, de nouer des alliances avec la santé, nouer des alliances avec l'agriculture, nouer des alliances avec la protection sociale durant la période de pandémie, donne de la visibilité à la nutrition. Et que dans le dialogue qui se passe actuellement sur la prévention et la prise en charge de la COVID, on parle beaucoup de système immunitaire. Et on nous considère, nous, nutrition, comme un intrant. Quand on parle de vitamine A ou quand on parle de zinc, tout le monde sait le rôle du zinc pour le système immunitaire. Donc, nous avons eu plusieurs, et nous avons toujours, je pense, plusieurs opportunités, et c'est là l'opportunisme que nous devons développer pour mieux nous insérer dans ce système holistique. Parce qu'aujourd'hui, nous ne pouvons plus travailler de manière verticale. C'est horizontal. Je pense que tous les gouvernements l'ont compris, mais c'est à nous de démontrer que nous, nutrition, nous avons déjà la solution. Donc, c'est ça l'apéritif. On peut développer tout à l'heure.
Oui, merci pour l'apéritif. J'attends beaucoup l'entrée, mais merci beaucoup pour votre précision. And thank you so much for talking so clearly. I was easily able to understand you. Lovely to see you again, Dr. Abdoulaye. Agility, opportunism, creativity. I'm not going to forget those words quickly. And that's lovely because everybody, that's what we're talking about. Sudden disruption of systems. It's no good waiting and doing a bureaucratic response. What Abdoulaye Carr is saying is, come on, we've got to be opportunistic, we've got to be creative, and we've got to be quick. And that's right, isn't it, Abdoulaye? That's what you've done. Well done. Merci beaucoup. I'd like to go to Bernice Cunningham. Bernice, je parle en anglais. There have been major disruptions in food systems and nutrition. What role do you see should be played by youth in driving a change? Bernice, you have the floor now.
Thank you so much, and it's a pleasure to be here with you all. I think from the youth perspective, we need actions. And I always remember a quote that say, think global, but act local. For this reason, I'm part of a multilateral process that says, act for food, act for change. It doesn't say tack for food, tack for change. It say act. And this is one of the things that we need to do. Stop tacking and start acting. Start connecting with the people that are suffering on these times, with the people that are having problems with nutrition in the local level. I think it's very important that we direct the investments in farmers, in local farmers, that we direct the investments in local youth, that we direct the investments in the most vulnerable people. And one of the most important things that we need to do is not to monopolize all the investment just in governments. We need to find ways that we could send investment direct on the people that are suffering. Here in Nicaragua, for example, in my country, when we have the COVID-19 crisis start, we have this dilemma that it was just impossible to lock down because some people have to decide, or I die without food, or I die of COVID. That was the thing that they have to decide. So I think it's very important that we understand that we are living in a different context in the world, and all the answers are not the same on the different places. And it's very important that we dedicate our time and our investments in the youth groups that are on ground fighting this war on health. And finally, I want to recall that in nutrition, there are a lot of simple solutions, and solutions that we know, and solutions that we should invest. And one of the things that I think when I understand this crisis is the phrase of Hippocrates: let the food be our medicine, and the medicine be our food. Thank you.
Bernice, thank you very much indeed. Let the food be our medicine and the medicine be our food. And let's involve young people and act now. Right through the chat, I'm seeing a lot of emphasis on immediacy, not waiting, and getting going. And our panelists have been fabulous and they've been very precise. But I want to give, because they've been so brilliant, I want to give each of them an opportunity to make one last remark before we move to the next panel. Just a sentence that you want everybody here, all 245 people who are connected, and the many more further away who are going to be joined on various live broadcasts that we're adding to this. I want your main message. So first of all, I'm going to invite our secretary, Laxman Hussain Mia from Bangladesh. What would your one sentence encouragement to everybody be right now on the relationship between nutrition and COVID-19, sir?
Thank you very much. Please give me opportunity again. It's a pleasure to me. Finally, with you ask me to with a sentence. We call for the accelerated and concerted action and long-term investment in nutrition to strengthen the food system of Bangladesh to be able to mitigate the impact of COVID-19 on nutrition outcomes. Thanks.
So that's it. From Bangladesh, ensure there is the capacity in the system to respond to the nutritional emergency. Thank you very much, Secretary. Very, very clear. Let me now go to our second speaker, to Shweta Kandawal. Shweta, your one sentence that you want us all to remember, and I'll repeat it, and I really will come back to it again and again. What would yours be?
Thank you, David. I think because I kept my first answer very short, let me just expand here. My solution is that because many of the chat questions are also asking solutions, they're asking what can be done in a country as populous as India. I think for both the quantity and quality of food which has been hit, it's important that we have a feasible approach to resolve this. And when I say feasible, it's just an acronym, very short. F for financing, E for evidence, A for augmenting or amplifying the capacity, S for systems approach, using COVID as an opportunity to rally for nutrition again across all systems. S is systems approach. I is for innovative ideas. B is for building mentorship, multidisciplinary tools. L is for effective leadership. And E, last but not the least, least but not the last, or whatever, is ecosystem for equitable access. That's my feasible solution for India. And before I end, I also want to say, try to be a lamp in a cottage, even if you can't be a star in the sky. So it's feasible, it's possible, we can do it, but we need convergent, collaborative action now. Thank you.
A lamp in the cottage if you can't be a star in the sky. Do something, make sure it's feasible, get it done. And then you had the really clear suggestions for what's involved with that E standing for equity. Thank you, Shweta, memorable. Let's now go to Abdullah Kar. Just a little bit, please, as we reach the end of this panel, on your instructions to everybody, Dr. Kar. What must we take away from your wisdom?
My wisdom, la sagesse, non, mais juste la réflexion. Avec la nutrition, on fait d'une pierre plusieurs coups. Et la nutrition est au service des questions transsectorielles, cross-sectorielles. Et la nutrition est une opportunité, une belle opportunité en ces périodes de vulnérabilité pour pouvoir servir de plateforme de réponse immédiate et efficiente et participative.
Magnifique. So this is Abdullah Kar saying to us, you know, remember you need to approach nutrition as a multi-sectoral issue. And even in this emergency situation of kids and others getting malnourished alongside their COVID, Abdullah Kar is saying, don't forget, be multisectoral. Is that right, sir? Because if so,
yes, and we are lovely and sexy nutrition. So we invite everybody. Yeah.
Okay, that's a little bit of extra. I will leave it in your words.
It's your extra. It's your dessert.
It's a nutrition is cool and enjoy. Thank you very much indeed, Abdullah Kar. Let me go now to Bernice Cunningham. Your last words to everybody, Bernice. The thing that you really want all 244 people on this Zoom to leave here resonating in their ears. Bernice, please.
The first thing that I want to them to resonate, especially to the people that are key political decision makers that are here, that you please put a picture of your children in your desk, and every decision that you're taking today, know that you will affect their life, and you're affecting the life of millions of kids that will suffer for the decisions that we're making. And finally, I think it's important that we need the youth on the table, because they are on ground working with farmers. They are working in campaigns like the pledge that we're forming right now. So it's very important that they heard, that their voice is given the necessary time to address the issues that they are working. And finally, time is now. Act now. Life is now. Thank you.
Life is now, act now,
Life is
involve
now.
young people, and make sure that when you make your decisions, you're thinking about the generations to come and not just people of my age now. We're, I'm afraid, not going to be around for long, but it's young people that matter. Thank you, Bernice, for reminding us. Everybody, this was our first panel. This was a panel that really got the voices of people in the countries, and I think it was brilliant. We can't all clap loudly because it never works, but I am just wanting to give my own thank you to our panelists. Thanks very much indeed. And now what we're doing is we're shifting from this engaging conversation about what's happening in countries with some really strong advice to you. We're now moving to another panel, which is going to have a conversation on how to drive investments that enable countries to benefit. And for this, I'm going to ask Stinneke Oenema, Executive Secretary of UN Nutrition, to be the moderator. Stinneke, before you get the panel started, just help us a little bit. In your experience, what's it taking to get nutrition to come up the agenda? We heard from Sean what an extraordinary improvements happened, and you've been watching this process. You're in fact quite intimately involved in it. So what's going on, and what more do we need to do to keep nutrition moving up to the top? Stinneke, you have the floor.
Thank you very much, David. Well, maybe I can answer that question by explaining what we do as UN Nutrition. That was in fact recently established by the merge of the UN Standing Committee on Nutrition and the UN Network for the Scaling Up Nutrition Movement. And as such, we really ensure that the very often divergent voices for nutrition come together. As UN Nutrition, we ensure that there is joint policy and advocacy for nutrition at both global and country levels. We support country action through the UN system as joint programming for nutrition. But we also work towards coherent joint UN voices for nutrition at all these global events, but also at country levels to really help to keep nutrition solid on the agenda. Maybe a few words about the pandemic, the COVID pandemic. As UN Nutrition, we worked also at several levels. Of course, our UN Nutrition Agency, the members, were active to respond to the crisis as part of their individual UN mandates in countries. And as UN Nutrition Secretariat, so us coming together, we collated all that technical material and brought it together in one central stop shop for information about the COVID pandemic and the nutrition responses, as well as the need to keep nutrition on the agenda. Maybe interesting to note is that we not just only supported country UN teams to help integrate nutrition in country responses, but also, and finally, what I'd like to say, as part of our work, we advocated to urge all stakeholders to keep nutrition and diet into account, to upkeep investments for nutrition as part of the response to the pandemic, because we all know, we have heard from the several speakers before us, there's so many pathways through which nutrition is affected by the pandemic and vice versa. So let's shut up me now for a moment, and I will now go over to the panel. We have a few very important nutrition actors, I would say. Leonard Mizzi from the European Commission, Mira Shekar, the Global Nutrition Lead of the World Bank Group, and then also Simon Bishop, the CEO of Power of Nutrition. And we will discuss among ourselves nutrition investments, very important. So maybe over to you, Leonard. You as the DG of agriculture in the past and nowadays as DG for partnerships, you give me the impression you have been hovering around and above nutrition for decades, always advocating for nutrition, taking nutrition into account. And it seems to me you are the perfect person to answer the question, why invest in nutrition? Of course, we heard several arguments of the speakers before, but imagine if I were not a nutritionist, what would you tell me to convince me to invest in nutrition? Leonard, the floor is yours.
Thank you, Steneke. Thanks, David, and thanks to the organizers for this very timely event. First of all, why invest in nutrition? There is clear evidence that investing in nutrition, which is a key component not only of food systems, so systems thinking is very important in this. This was one of the essays of the feasible that our Indian colleague mentioned, systems thinking, because nutrition is very cross-cutting. Also because it's a key component of human development. And what has been impacted significantly in COVID, it is the human development dimension. The first 1,000 days, we can speak about jobs, about growth, about investment. If we don't invest in nutrition in the first 1,000 days, we will not have healthy kids to go to school. We will not have healthy adolescents and young people to do productive jobs. So that is first, and the European Union has called the shots in the past programming period 2014-2020. We have invested well over the target of 3.5 billion. We are now in the 4.3 billion target, and we will report on it in the run-up to Tokyo during the second half of this year, during the Slovenian presidency. But also we are doing programming for the period 21-2027. And if you tell me, is it a done deal to actually continue investing heavily in nutrition? And I will say it's not a done deal, because there are lots of competing demands out there, not least the issue of vaccines was mentioned, the issue of strong education systems. But I think there is a clear demand for a more multi-sectorial, interministerial approach, because just investing, Steneke, will not do the trick. I can come and give you loads of figures about how much we invested in 2020, 494 million. But I can also show that we need to do a smarter job. And I see lots of questions about what could be game changers. We are in the year of the UN Food System Summit. We go to Rome on the 26th, 28th of July. Lots of Q&A were on the UN Food System Summit. Then we go to Tokyo. Then in the middle, we go to New York. What will be the game changers? And out there is still, I would say, a multiplicity of ideas, of which nutrition is there. But for example, what type of inclusive business model we want? Because what COVID has created, it has created a bigger gap not only in the developed world, but in the developing countries. So how to reach out to those who are most vulnerable, from the farm to fork, as we say in the EU Green Deal, small farm holders, women leaders in cooperatives, the youth, and also the children who we push a human rights-based approach in our portfolio and thinking. But this is not an easy process because it requires an interministerial buy-in. So one of the solutions is, it's not just a question of how many billions you fund, but what are the smart investments? I was in one of these Zoom events, and it showed, for example, in the African Union and the African countries, that despite lots of investment as part of the CADE process, the Comprehensive African Development Program, some of the investments never reach the targets. Why? Because either of misalignment, misprogramming, communication problems, lack of absorptive capacity. So the first thing we need to do to get the best out of our nutrition investments is to have a cross-cutting approach. Those countries which have the highest buy-in in terms of governance, in terms of buy-in from a multi-stakeholder approach, in terms of transparency, clearly have a higher return on the investment. Secondly, I think we also need to go beyond the health ministry or the agricultural ministry. We need to have really a design program in close collaboration with the Ministry of Finance, so that if we do budget support, it is clearly done with clear metrics, with clear targets. And this we do via our budget support interventions. Last but not least, private sector investment. You will not do the game changers if we don't invest heavily in terms of private investments. And this we are trying to do with our European development finance institutions to de-risk investments, especially in small farm holders, in that missing middle, which is not an automaticity, because the de-risking of farming systems from a systems approach, and I'm not speaking necessarily about the gazelles of this world, I'm speaking about fragile states, it's not easy, and financial institutions need bankable projects. So I think in terms of food fortification, in terms of visioning of what we want to do in terms of scalability of our nutrition investments, in terms of intra-regional trade, we haven't spoken at all about trade. If you want to create dynamics of nutrition about livelihoods, about a systems thinking, we need to create those vibrant local and regional markets. In Africa, those don't exist. We are still in 54 fragmented markets. And if we want to create regional dynamics, it requires systems thinking in terms of food safety, in terms of trade barrier dismantling, in terms of quality control, in terms of logistics, in terms of infrastructure. COVID is a risk, but it's also an opportunity to build back better, to depart from a business as usual model, but it requires also strong governance at multi-sector and multi-level, national, regional, and global. And hopefully between Rome, New York, and Japan, we can come up with those game changers so that we can move forward as from early next year. Over to you.
Thank you. Thank you very much, Leonard. I mean, you made some very important points, and just to highlight two of them. First of all, we need to deal with competing demands. And we could do that by integrating nutrition in several sectors. And in addition, we need to make smarter investment in nutrition. So be very smart, make very good and clear targets and act upon those. So just those 2 points, but you made so many more valuable points. But I'd love to move on to our next panelists. Mira Shekar, we all know you as the Global Nutrition Lead at the World Bank Group. You're known for authoring many leading documents, among others, the Investment Framework for Nutrition, of course. We find ourselves at the eve of the replenishment of the IDA of the World Bank. Can you tell us what is needed to ensure that nutrition is part of that replenishment, that it is or remains integrated? Mira, over to you.
Great, thank you very much, Stenike. And I want to reiterate many of the comments that Leonard just made, as well as much of what we heard in the morning from some of the others, especially Shweta's feasible approach. I must say, I really do like that. And as we've heard from everybody, action is important. The time for talking is over, but now it's the time for action. And action is not possible unless we have the resources to act. at a time, my mantra has always been more nutrition and more resources for nutrition, but also more nutrition for the money that we are spending. And some of the things that Leonard just said reiterate those issues as well. The focus on evidence, the focus on making sure we invest in high impact interventions and we can get results. So in terms of IDA, at a time like this with the COVID crises, we know ODA is challenged. We know that domestic resources in countries is challenged as well. And so the three sources of financing that become really important are innovative financing. I know Simon's going to talk about that, so I won't speak more on that, but also private sector resources and concessional financing. And on concessional financing, certainly IDA is a big player, and we hope we can make it a bigger player as we go along. So just on that, as some of you may have heard, IDA 20 has been brought forward. The replenishment of IDA, which would normally have been next year, has been brought forward to this year. And the final decisions on what the IDA replenishment will look like will actually happen towards the end of this month. So anything I say is just simply items that are on the table in terms of, I'll focus on the nutrition issues, but everything is still on the table and being discussed. In terms of what is being discussed, certainly there's a lot of discussion around climate, around gender, around jobs, a strong focus on fragile and conflict states where it's really important to act, a very strong focus on crisis preparedness, as you can imagine, and lots of conversations around food and nutrition security. So in the bank, we are really making a concerted effort not to talk just about food security, but to talk about food and nutrition security in one breath. And those on this panel and listening on here know exactly what that means and why that is important, not to separate the two issues. And in looking for solutions for these issues, we are really seeking cross-sectoral solutions, as many of you have mentioned earlier, and cross-sectoral solutions that bring the whole of the World Bank's efforts together across sectors: social protection, agriculture, water and sanitation, health, governance, as Leonard mentioned as well. All of these things together, a whole of World Bank response to this really big challenge. There's some discussions ongoing in terms of the crisis response window that we have. But there's also a very good discussion ongoing that we need to respond both in the short term through issues, through mechanisms such as the crisis response window, but we also want to be able to respond in the longer term. And several people have already mentioned how important that is. And then lastly, I do want to mention one of the new themes that is being discussed, and I really want to emphasize it's being discussed. Nothing is agreed as yet, so I don't want to commit to anything. But one of the new things that's being discussed is the human capital theme. And I have a couple of slides that I want to share with you. So if tech support will put the slides up. I just want to emphasize the fact that because human capital is becoming so critical in the bank's work, we've done a fair amount of work trying to link how nutrition links with human capital. So can we get to the next slide, please? I just have 2 slides. So in this next slide, you see how human capital is defined as a measurement of a child that is born today. How much human capital can she hope to acquire by the time she is the age of 18? How productive can she be over time? And if you look at the human capital index, the index is three things: survival, school, and health. And the human, if you go to the next slide, and those of you who are more interested, please click on the link at the bottom of the slide. But what I really want to emphasize here is the link between the human capital index and nutrition. And so on the left-hand side, you see the index, one component of the index, which is survival to age 5. And we all know, everybody on this in this conversation knows that undernutrition underlies 45% of child deaths. So you can see how that is clearly connected to nutrition. If you look at the quality of learning, lots and lots of evidence that shows that stunted and anemic children learn less. Children with iodine deficiency have lower IQ. So again, a very strong link between learning and nutrition. And if on the health side, there are two components: stunting, which again, everyone is very familiar with, but also the other component is adult survival rates. And that is essentially a fraction of 15-year-olds who survive to the age of 60 years. And all of us know that we've seen increases in obesity rates across the world, but even in low-income countries, particularly in low-income countries. And those are contributing to non-communicable diseases and adult survival rates. So nutrition is so intricately linked to human capital that we are really hoping, as we push forward on this human capital theme, that nutrition can become even more important under the next IDA application. Let me stop there for a moment.
Thank you so much, Mira, for sharing these insights about IDA with us, even though they are still on the table and are being discussed as we speak. I'd like to go to our third panelist without further ado. Simon Bishop, you are the CEO of the Power of Nutrition, which is in itself an innovative finance mechanism for nutrition. Could you explain to us a bit more what this is? What is innovative financing for nutrition? Is it a good avenue to pursue? Could you give any examples? Simon, over to you.
Fantastic. Thank you very much, Seneca, and hello, everybody. Yes, we see a huge opportunity in innovative finance for the global nutrition sector, as well as a risk as well. We know we need trillions, not billions, to achieve the global goals. And we know that most of that will not come from traditional grant aid. It will come from other types of financial flows and mechanisms. And if I give you an example, in 2007, 50 billion flowed into impact investing. So that's just one subsector of innovative finance. 50 billion flowed in 2007. In 2020, 750 billion flowed into impact investing. So if the global nutrition sector could access even a small proportion of the innovative financing that is flowing around the world, it could play a significant role in plugging some of that 7 billion, or with the Standing Together for Nutrition figures, 8.2 billion financing gap that we see annually globally. So there's a real exciting opportunity. At the same time, there is a risk. And the risk is that if we don't prioritize this, we are going to unwittingly replicate our orphan status that we've had for the last 30 or 40 years in the traditional grant aid world. We're going to replicate it in the innovative financing space. And if I just give you 3 examples, there have been 630 green bonds that leverage $290 billion in 2020 alone in green investments. There have been just 2 nutrition bonds. 5 health impact funds have leveraged 285 million in the last few years. There are no nutrition impact funds. And if you look at social and development impact bonds, there are about 150 of those globally. 30 are in health, 24 in education, and there's only 1 in nutrition. So we're already at risk of replicating that orphan status. However, like Sean Baker from USAID, I am an optimist, and I think, and my colleagues at the Power of Nutrition believe, there's a huge opportunity for nutrition to play more in this space. We're seeing a kind of a wave of so-called financial intermediation. So what does this mean? This means bringing the best brains and people and organizations from the finance world together with the development world to try and leverage more financing for a wide range of development issues. We need to be joining that wave and actually helping create that wave and making sure that nutrition is absolutely central to that wave. And that's what the Power of Nutrition, that's one of our key priorities moving forward. That's what we're aiming to do in collaboration with sector colleagues. So we'd love to hear from any of you if you'd like to hear more about our plans and how we think we can go about doing that. And if we have time, Seneca, obviously I'm very happy to talk more about that. But the key for me is, instead of a challenge, think of this as an opportunity. We could be, as a sector, pioneers in innovative finance. Instead of us phoning up education and saying, how have you managed to do that? How have you leveraged those hundreds of millions? Instead, within 5 years, it's education colleagues phoning us up and saying, how on earth have you managed to bring in several hundred million, possibly billions, into the nutrition sector? I think that's the goal we all need to aim for when it comes to innovative finance for nutrition. Thank you.
Thank you. Thank you so much, Simon. I thank you also for being optimistic. And I thank you for your quote, financial mediation. You may have used it everywhere in your career already, but it's new to me. So that will stay in my mind and I will continue using it because I see that gap and we need to bridge that gap. So financial mediation, not just nutritionists, we need to bridge, we need that financial advice and financial mediation in order to get the resources we are needed in order to be able to take action, as Mira said eloquently before, Simon. So I would love to chat on more with the 3 panelists, but I'm afraid time is up. So I'm handing back over to David Nabarro to moderate the last part of this webinar. David, over to you.
Saskia, thank you. And everybody, I really appreciate the energy that came from the panel with Saskia, somebody who's been perhaps not in the mainstream of nutrition thinking for some years. It's very exciting to hear from Leonard Mitzi and then from Mira Shekhar and then from Simon Bishop that this is an area where there is a real interest in investing within the context of wider thinking. And I was particularly impressed by the way in which each of our speakers brought nutrition into a wider set of concerns. So you could understand, Stenica, why they're moving beyond optimism actually to a real sense that there is a pathway and that the pathway can be found, and that within some of the events that are coming up in the near future, this pathway will lead to bigger potential and actually bigger investment. So that brings me, Stenica, to the last part of this session. And I'm going to really try to ask everybody who's been involved in this session to consider 3 big questions that have come through. And I'm going to give you all of you the 3 big questions. I'm going to wrap them together, and then I'm going to go to everybody and I'm going to say, what is your contribution? And then we have to finish on time, but I think we'll get there. I may need a bit of help. So all panelists who are still here and who are ready to talk, please light up your video so I can see you. And here are the questions and the people who've been asking. First of all, I would like to give you what Roxana has said. How can we prioritize immediate actions for nutrition without extra funding? Now, this is a situation that many panchayats in India were in last year, when hundreds of millions of people left the big urban centres and went towards their homes. And there was a need to make sure they could access nutritious food. And it was tricky because it took time for the money to come through. It did come through in the end. But the question to everybody is how to get nutrition prioritized without the cash. Number two, next one came from Swati. How to bring nutrition interventions both into the COVID prevention and control agenda and into concrete actions for recovery. So we want to mainstream nutrition in COVID speak and in COVID action. And then thirdly, from Smriti, how to maintain the current momentum for acting together that we've all got. And then a fourth question from Pat. In terms of child mortality, is there a case to be made for greater attention to child mortality as part of the world's attention to human rights? And can we put the child mortality impact of COVID into that human rights space to try to get more action? So those are the questions, just to pick up however you would like, and let's go right through. Let's go back to the beginning and just see whether or not we can hear from people. Saskia, would you like to start? Is there any comment you'd like to make on those questions that have been asked? And pick on whichever one you'd like.
Yeah, the question on how can we ensure this momentum that we have during this crisis of really acting together. We saw that also in nutrition. Very much so that this really brought people together and speak more with one voice. It was also another comment that was raised. And I think that's very important. And I think events like this can help in ensuring that. And yes, we need to find a way to continue working together like we did during the pandemic, also after COVID, and make sure that that the evidence that is generated in the various groups is being translated into these powerful messages that can also convince others that are not naturally thinking about nutrition of the importance. So the financial figures may help there of the importance to invest in nutrition.
Brilliant.
So I very much think we need to continue with working more together. Thank you.
You are so amazing, Saskia. You've gone straight for the key question of maximum impact and showing your commitment to leadership. We love it. Thank you. And to Sean Baker, I've given you a selection to choose from. Plus, you've also heard other people speaking. It's your moment to give your, I suppose it'll probably be your final reflections before the end of this session. Sean, you have the floor.
Thanks, David. So I was going, in that menu selection, I was going to try to go for 1 and 2. I don't think any of us should be satisfied with no additional funding. At the same time, I've been incredibly impressed, at least virtually, talking to implementing partners on the ground, our partner governments, of the incredible tenacity and innovation about how do you pivot to keep essential actions going in light of the COVID pandemic, be it how do you go from very in-person social behavior change to using anything from cell phones to social media, et cetera. How do you keep businesses that produce nutritious foods, including fortified foods, open? And so I take from that our huge investments in the people on the ground, the institutions on the ground are paying off, and there's huge wisdom out there that we need to enable and draw upon. And then in terms of nutrition, the COVID and recovery, I mean, the themes I hear of, we want to save lives, we want to safeguard progress, and we want to build back better. Nutrition resonates with all of that. So I think it's a lack of understanding of how nutrition underpins everything we're concerned about. If we, the increased mortality due to increased undernutrition has started as soon as the lockdown starts. So if we want to save lives, particularly children's lives, nutrition is essential. We risk losing a decade of progress. And we know that it's not just losing progress and lives saved, but in fact, as Leonard had pointed out, others, that human capital, we could lose a whole generation of kids for whom we've deprived them of better futures. And I think others have said this, the pandemic is an opportunity because it's really tested every part of the health system, every part of the food system, every part of social protection We know exactly what we need to do to build back better to deliver on nutrition. So I think it's getting our narrative correct that this is a non-negotiable as we fight the pandemic and build back better.
While you were talking, I wrote down vital, but I think non-negotiable is really good. Everybody hold those words. It's not an option, it's absolutely essential. And I'm sure we'll hear that more from our other panelists. I'm trying to cycle through as quickly as we can in difficulty. Megan's gone, had important work to do. Thank you, Sean. So let's now go to Stinica. Stinica, your moment. And then Stinica, do you want to bring in your panelists quick, if you can, to see if we can give them a chance to speak? I'll tell you what, I'll bring my other panelists in first. I'm sorry, I missed them. Here we go. I'm just going to come to you in a second, but is Laxman Hussain Mia still on? Any comment on the questions from you, Secretary? Would you like to? I know it's awfully late. All right, might come back to you. Shweta Kandawel, would you like to comment on the question?
Thank you, David. I think I like acronyms a lot. So as for COVID, we say COVID appropriate behavior, which is the CAB. I thought for these three answers, whether it's about prioritizing or concrete actions or momentum, I also have a CAB here, which is capacity, C for capacity, because I think building up capacity relatively quickly without cash is also one option. Using local leaders, local youth, that's very, very important for me. So therefore, capacity is for C. A for advocacy with all my might and with everybody's might. So that's my A for, CAB. And B is build back better, as all of us have been reiterating. Build back better with local solutions. Again, my emphasis is on the word local here, because I think the solutions will come from your own region. Thank you.
And so I'll bet you that when it comes to advocacy, you do not hold back. You are there, you are strong, and that's so important. Thank you. Secretary, sorry, Shweta. Secretary, Mr. Hussain, would you like to come in now, sir?
Thank you very much. Please give me an opportunity again. COVID-19 threatened to reserve this trend and risks, undoing the hard-earned progress that been achieved. WHO 2020 as on the additional 3.9 million children under 5 could suffer from the wasting of the South Asia this year due to COVID-19. I recommended keeping nutrition high on the agenda, strengthening the nutrition service, and leveraging the Sun movement and the multi-sectoral platform, and also social and economical protection mechanism are lifeline to the household already struggling with the food and nutrition security. Engagement and meaningful interaction with all agencies, within the government to address the challenges in need to, as much as multi-sectoral platform, and no one single actors can address such challenges on their own. Collaborating is key.
Right, I love that, Minister, Secretary. I love that because you've stressed we have to do it together, and we have to do it using the platforms. Thank you, and thank you for your leadership. To Abdullah Kar, try to be as quick as you can, just because I'm running out of time.
Oui, David, juste par rapport au ministre des Finances, pour le convaincre, en cette période, je pense qu'il puisse comprendre que la nutrition, comme investissement, en fait, donne une intersection entre la santé, l'agriculture et surtout santé et agriculture, ces deux aspects qui sont extrêmement importants. La nutrition constitue l'intersection. Comment on peut développer le rationnel pour que le ministre des Finances le comprenne? Parce qu'on parle d'économie résiliente. Pour que le pays puisse être autosuffisant sur une alimentation de qualité, pour avoir un effet sur la santé, mais aussi avoir de la valeur ajoutée et intégrer des chaînes de valeur qui soient réellement nationaux et locales.
So everybody, good nutrition is resilience. And the Minister of Finance loves resilience, because that's strength and that's a real asset. So thank you, Abdoulaye. And Abdoulaye, I know you spend your time chit-chatting to the Minister of Finance in Senegal, and I look forward to more info on that as we move towards the Food Summit and Nutrition for Growth. Thank you very much. Bernice, would you like to give your advice based on these questions you've heard? You have the floor.
Yes, I think we have to realize that climate change is affecting some of these countries in a very hard way. In Nicaragua, for example, we didn't have rain, and this is affecting all the food systems. So I will emphasize again on the fact that we need to put the youth voices on the table to discuss these solutions. Thank you.
Young people not as an afterthought, young people there in the front, at the center, leading the effort. Thank you very much. And the rest of us, we've got to actually do our part and not simply just say, no, it's up to the young. No, we have a responsibility. Thank you, Bernice. Stinica, please, your moment.
Yes, thanks, David. And allow me to go to the panel first, and I might take the liberty of answering one question as well. So maybe, Leonard, would you like to provide us with your thoughts related to the 4 questions?
Stinica, I will try also to blend 2 questions. First of all, multi-stakeholder approaches requires from the farm to the fork. So we need, for example, what we are trying to do in certain value chains, cocoa in Ghana, Cote d'Ivoire, involving farmers' organizations, traders, private sector, youth, women's organizations, ministries of environment, ministries of agriculture. This is a systems thinking which requires from the bean to the chocolate. It's not an easy process because, David, we need also to embed a human rights-based approach in all this. Also linking to the Ministry of Finance, as our Senegalese colleagues.
As Abdoulaye said, yep.
This is important. We can speak to the Ministries of Agriculture, of Livestock, of Fisheries. If the Ministry of Finance with the Prime Minister or the President don't get the buy-in of the intersectorial complexities, but also of the opportunities, then this is a missed opportunity. Secondly, it would be good, Saskia, if we can get what Simon said earlier on, the development finance institutions in this debate. The donor community will not address the financial gap. We need to leverage with innovative financing. There is financing out there, but we need to make it bankable. We need to link good policies with smart investments, and evidently the DFIs have a critical role to play. Otherwise, the gaps will remain there. Over to you.
That's excellent, Leonard. You said it's not easy, it's complex, but it's doable as long as we are able to convince the Minister of Finance and, if needed, the Prime Minister as well. And then again, of course, innovative finance to complement good policies, good smart policies. Mira, over to you. Any additional thoughts? All the questions, one question?
Yeah, great questions and great conversations as well. I think from the only additional thing I would add is that we really need to break out of this echo chamber that we have of talking to ourselves. We all reiterate to ourselves that we need to do this, but the important thing to do is to bring other people, other sectors, other decision makers into this echo chamber. We need to join hands with them. We need to focus on trying to get more resources for nutrition, but also more nutrition for the money that is being spent, so that we can speak to efficiency of spending. Those are the sorts of things that ministers of finance want to hear about, and as well as development ministers. And as Leonard said, the development institutions like the bank that I work with have a really important role to play in this. We're ready, we're willing, we're able to play this role, but you need to keep nudging all of the development finance institutions to do more. And also at the same time, be able to show that we can produce results, because ultimately nothing succeeds like success itself. And that is really critical. So let me stop there.
Thank you so much, Mira, for reminding us that nutrition is too important to leave to nutritionists alone. We need to reach out to others. Simon, over to you. Any final thoughts?
That's a good segue. Thank you, Mira, of mine, and I'll answer question one. Around the world, big companies aren't just being measured on how much money they make, their bottom line, but increasingly on their environmental and social track record. And in fact, they can borrow money, borrow capital in the markets more cheaply if they have a proven positive environmental and social track record. However, huge amounts of money is going into environment and climate change, obviously welcome. But I was speaking to a financial analyst the other day. He said, absolutely would go into the social bit and into nutrition if these big companies and if big investors like pension companies knew anything about nutrition. They don't. We could literally have 2 people running around the world educating ESG departments of big multinationals and of big investors like pension companies. And 2 people could leverage, I'm confident, hundreds of millions into the sector.
Thanks. That's another valuable thought. We need to, in fact, really make use of these very few people that have this ripple in the pond effect, this wave, this tsunami for nutrition. And if you allow me, David, could I say maybe one final word about the question about human rights that was kind of addressed in between the lines a little bit? But of course, that's a very wholehearted yes. Of course, there is a case for human rights if children are dying. We have a convention on child rights. We have the right to food. We have the right to health. And these rights are indivisible. And these rights come with responsibilities. And that's the word I wanted to say again. Rights come with responsibilities. So governments act. We know what we can do. We can and should mobilize the resources. So let's go for it. Let's do it and let's save these lives. Thank you so much. Over to you, David.
Well, everybody, we're right up against the wire. We've had a really amazing session, super lot of material packed in. And we will be closing very, very shortly. I'd just like to acknowledge that the interpreters are still here. Thank you for giving us just a little bit of flexibility. Everybody, 171 people connected just now. You are part of the nutrition effort that has built up over the last 20 years. Nutrition has become more visible to decision makers, and its significance is without question, but it's still one of the best kept secrets in the world. And you have been asked by your panelists to keep bringing nutrition out of that little box and to make sure it is mainstreamed. And you just look at what Mira Shekhar has done in the World Bank. As the lead nutritionist, she has managed to get the subject so that it is in the minds and in the words of those in very senior positions, because she's shown them that nutrition contributes to human capital. And it's that kind of effort by all of you. Sean working in USAID, Secretary Hussain inside the Bangladesh government, informing the Prime Minister all the time of what's going on. And then the efforts in India, which are beautifully, beautifully given to us and clearly articulated just now as we were getting these excellent ideas from Shweta. And then Abdullah Kar saying, look, you've got to actually get the Ministry of Finance there. And then Bernice saying, and if you don't involve young people, you're nowhere. So everybody, that's the message. Get the secret out there. Don't let it be a secret anymore. Nutrition is transformative. And in COVID, nutrition has been hurt. And there are children and there are adults and there are older people as well as younger people who are just really suffering because of this COVID. And I think we've all heard about it, and some of us have seen it, and it's just not going to be at all compatible with the developments that we've been working for. And remember, COVID is still here. It's huge and it's not going away. It's swirling and surging. And so just everybody, if you talk COVID, if you talk human rights, if you talk human capital, please talk nutrition all the time. There's still a lot more to be done. Thank you, everybody, for being here. And look, just a few quick comments. We're asking you to contribute your voice. So we're going to put a poll up at the end. And I want you, as you fill that poll in, also to be thinking all the time, what am I going to be doing more for nutrition in the coming months and years? Share the messages on social media, in broadcast media, in your workplaces, in your universities, in your social lives, with your friends, with your partners, with your families, with those you love, because it's the most important message. Nutrition matters, and you've all helped to bring it up into the public domain. Please don't stop. With all of your thanks and our thanks to the organisers, you heard who they were. Special shout out to Saskia Ossendar, who basically has just very much pulled this together. But Stinica has had a huge role in it, and Nola Martin and many others who are actually behind the scenes, and we don't see them, but we know that this work only happens because people just give and give and give and go on giving. So that's what we've got to do. We still have to give for nutrition. Bye-bye, everybody. Best wishes. Think hard about nutrition for growth. That's going to focus our minds. Thank you to Simon. Thank you to Mira. Thank you to Leonard. Thank you to Saskia. Thank you to Mr. Hussain. Thank you, Abdulaikar. Thank you, Sean Baker. Thank you, Stinica. Thank you, Bernice. Thank you, Shweta. Thank you, Nola. Bye-bye, everybody. See you again soon.
Thank you.
Thank you. Bye.
Thank you. Bye.
Bye, everyone.
Thank you. Bye.